This is one patient's story about a surgical procedure that's helping people win their battle against cancer and keeping their quality of life. This surgical procedure made a remarkable difference in my life, and it's making a difference in the lives of many. I was diagnosed with stage 4A cancer. There was a large tumor on the lower base of my tongue, and it had spread to the lymph nodes in my neck. It was squamous cell carcinoma. This is an area that's challenging for surgeons to remove cancer without causing damage to adjacent structures. If you think about it, your neck's packed with lots of important things, and they're pretty close together. Located in this area is your voice box, your windpipe, your esophagus, your tongue, your salivary glands, and there are also muscles that move your head and neck and jaws, and there are nerves that control the movement of your shoulders. Also located here are lymph nodes, lymph vessels, major blood vessels, your spine, and a whole lot more. Opening your face, neck, and throat using conventional surgery in this region significantly threatens these delicate structures and the normal functions they perform. In my efforts to learn more about this surgical option, I discovered that conventional surgery could create a wound that, even when healed, can interfere with your mobility and normal functions for the rest of your life. It also carried a risk of physical disfigurement. The choices I had were pretty limited. It was chemotherapy, radiation, or conventional surgery, at least so I thought. No matter which one I chose, it would likely require some combination of the others. Each of those choices had significant drawbacks. Doing nothing meant a painful and agonizing death. Things were looking pretty bleak, to say the least. As a young combat veteran, I learned early in life to never give up, no matter what. I learned that winners were the ones that didn't quit. I never forgot those lessons. With that mindset, I decided I wasn't going to accept the status quo. I continued to look for more answers and more options. It was then when I discovered a relatively new medical procedure called Transoral Laser Microsurgery, or TLM for short. It was being performed at the Mayo Clinic here in Phoenix, Arizona. Transoral means going through your mouth and not cutting through your neck and jaw. As I learned more about TLM, it became apparent to me this minimally invasive technique was enabling patients to leave the hospital faster, and it seemed to be controlling the cancer better and even eliminating it in many cases. The surgeon uses a microscope and a laser to view and cut out the cancer without opening your neck. Normal surgery for this type of tumor would require a large block of healthy tissue being cut away around the tumor to help ensure clear margins. With TLM, it seemed that much of the guesswork would be eliminated. The tumor is cut out piece by piece until all of its traces are gone, and with much less damage to the surrounding tissues. The microscope and the laser ensures greater precision and greater certainty for the surgeon. Based on this new information, it seemed to me that TLM had a higher probability of completely removing the cancer and allowing me to retain normal speech, swallowing, and other important functions. Based on all that I knew and all that I had read, I chose TLM to strike back against the cancer that was invading my body. It turned out to be an excellent choice for me. I was talking immediately after surgery, and I've been pain-free ever since. I was out of the hospital in 4 days, and I was eating normally within weeks. Clearly, both my life and the quality of it were preserved by this remarkable procedure and the incredible team who performed it. For me, TLM was a tremendous success. Because of that fact, I made the choice not to undergo chemotherapy or follow-on radiation. It's now 18 months later, and numerous tests and examinations have been performed. And so far, there's been no further evidence of the cancer. This may not be the end of this journey. However, I can tell you that my future right now looks very promising. Pioneering the TLM technology at Mayo in Phoenix is a true medical leader. His name is Dr. Michael L. Haney. I've been richly blessed by his extensive knowledge, experience, and skills, along with those of the medical professionals on his team. Each one of them is a dedicated medical care provider continuously striving for excellence. This innovative technology and these remarkable people have made an incredible difference in my life, and they're doing the same for many. I extend to each one of them my deepest appreciation and my most heartfelt thank you. I pray that God richly blesses them in their continuing efforts. I hope this information helps you. Don't ever forget that life is 10% of what happens to you and 90% of how you react to it. Whatever you do, don't ever quit and don't ever give up, no matter what. Thank you for watching, and I wish you and your family the very best of health.